Hello guys, it's me again and welcome to our newest series, the OET Series. I've added OET to our IELTS series because I believe that this will be able to help our healthcare professionals who are aiming to work abroad. So we've got the medical doctors, we got the nurses, and our health allied professionals as well. So for our first video in our OET series, we're going to focus on writing. You know that C+, the writing score requirement when you're applying for work abroad, such as the United Kingdom. Okay guys, so again, welcome to our first video in our OET series, and we're going to focus on writing. Okay, so on your screen, you'll see two windows. So on your left, you have the OET Sample Nursing Test booklet, and on your right, you have the sample letter. Okay, so let's begin. So we have the OET writing subtest for nursing, and you're aware that the reading time is 5 minutes and the writing time is 40 minutes. So you'll be presented with a case note and you have to complete the writing task which follows. Okay, so let's scan the notes. According to the notes, assume that today's date is 7th of September 2018 and it's about Mr. Gerald Baker, a 79-year-old patient on the ward of a hospital in which you are a charge nurse. And you can see the patient details below. So we know that he's been a widower for 8 years and he was admitted on the 3rd of September in City Hospital. And then he's being discharged today, 7th of September 2018. Okay, so take note that he was admitted on the 4th of September because he needed a left total hip replacement as elective surgery. And note he's also got worsening osteoarthritis and he's got difficulty mobilizing and climbing stairs. So below is his social background. Okay, no children, and he's got a sister who visits regularly and very supportive, and he's got no dementia as well. For the medical background, you have 2016 osteoarthritis requiring the hip surgery, 1989 hypertension, and he's on medications, and then 1985 you got Cole's fracture and ORIF, or open reduction internal fixation. Okay, so for medications, you can see here aspirin 100 milligrams main means in the morning. So you've also got Ramipril 5 milligrams in the morning, an ACE inhibitor for his hypertension. And then you have Panadane Forte, paracetamol 550 milligrams / codeine 30 milligrams, 2 tablets, 2 QID. QID means 4 times a day. PRN is Prorenata or as needed for pain or fever. Okay, and then you have nursing management and progress. So he needs daily dressings on the surgical incision site, range of motion exercises, stretching and strengthening, occupational therapy, and his staples are to be removed in 2 weeks, which is on September 21 or 21st, and he's got a follow-up visit for blood tests, FB and UEC at City Hospital Clinic. As per assessment or on assessment, so he's got good mobility post-operatively and he can weight bear with the use of a wheelie walker, and he's able to walk length of the ward or along the ward without any difficulties. So they've also noted that he's got post-operative disorientation regarding time and place during recovery, and they're correlating or associating this one to anesthetic. And they're advising continued observation as well. So in addition, he dropped his HB. So HB stands for hemoglobin. So that's also post-operatively down to 72 grams per deciliter, and he had 3 transfusion of 3 units packed RBC or red blood cells, and then it stabilized to 122 grams per deciliter on discharge, and there's ongoing monitoring for anemia. For the discharge planning, we have to monitor medications like his pain relief, preserve skin integrity, continue exercise program, and he requires some equipment such as wheelie walker, wedge pillow, and toilet razor. And then it says there that the hospital is set to provide the walker and the pillow, and the hospital social worker has organized the 2-week hire of the razor, that's the toilet, for the toilet I mean, from the local medical supplier. So for our writing task, it says here, using the information above, write a letter to Miss Samantha Bruin, senior nurse at Gracewell Nursing Home, 27 Station Road, Gracewells, who will be responsible for Mr. Baker's continued care at the nursing home. So in your answer, expand the relevant notes into complete sentences. Do not use note form and use letter format. Okay? And then, the body of the letter should be approximately 180 to 200 words. Okay? So that's it. So let's go to our sample letter. So we start with the recipient, and that's Miss Samantha Bruin from our writing task, and she's a senior nurse, and to be followed by the address of the nursing home. And then we have the date today. So according to our questionnaire or test booklet, assume that today's date is 7th of September 2018. Okay, so let's highlight this one. That's gonna reflect here. And then you have RE, or regarding Mr. Gerald Baker, day of birth. So normally, I would put the day of birth of the patient because that's part of the identity check. However, it's not given in our test booklet. So, we may use the patient's age. So, I'd delete DOB, and then instead, we can put age 79. And then we proceed with your salutation, and then your first paragraph. So let's go to the first paragraph. I normally begin with I'm writing to you because it has to be professional as we're writing to another professional. So in this case, it's to another nurse. Okay, so I'm writing to you regarding Mr. Baker, who was admitted to us on September 3rd or 3rd of September. He underwent a left total hip replacement on 4th of September, and he's being discharged into your care today. Okay, so in my view, these are the important details we have to include. So I'm writing to you regarding whom, and then the admission date, which can be found here. Okay, and then what happened during this admission. So it's the surgery on 4th of September, and what's happening today. Why am I writing to this person? Because he's being discharged back into the nursing home. Okay, and then the second paragraph. So we have, during his post-operative recovery, Mr. Baker appeared to be disoriented to time and place, and this may be anesthetic related. In addition, his hemoglobin or HB levels had dropped to 72, requiring transfusion of 3 units of packed red blood cells. On discharge, his HB levels 112, and I recommend continuous monitoring of his orientation and hemoglobin for signs of anemia. So I've included this part from the assessment because I just felt that they're about safety. So patient safety, we have to ensure that they've been included into our letter when we are handing over our patient to another healthcare professional. Especially in our field nursing. Okay, so I've included the disorientation and the HB drop, and they said here continued observation recommended, and then they said here continued observation recommended, and then ongoing monitoring required for anemia. So I have included both of them in the letter. Okay, third paragraph. So my third paragraph is about medications. Okay, in this specific case or writing case, so Mr. Baker has been recommended on daily aspirin 100 mg post-operatively, aside from his antihypertensive tablet Ramipril 5 mg. He may have 2 Panadine Forte, paracetamol 550 mg / codeine 30 mg tablets 4 times a day as needed for pain. Especially, he will be needing daily dressing changes on his surgical incision site to preserve skin integrity. Mr. Baker has got not many medications, so aspirin, probably prevention for thrombophlebitis, which is one of the common complications post-operatively. And then he's got Ramipril, his usual medication for his hypertension, and his pain relief because he's a post-operative patient or surgical patient, and pain is a common experience after surgery. So you can see that I've also linked pain relief to his daily dressing changes. So normally, prior to changing the dressing, we'd offer the patient pain relief, okay? And that's to preserve skin integrity as well. So I've started touching the nursing management part in our test booklet. So going to the fourth one, I've decided to talk about rehabilitation because that's one of the nursing management and discharge planning for the patient. So in line with his rehabilitation, Mr. Baker can weight bear with a wheelie walker and demonstrate good mobility by being able to walk the length of the ward without difficulty. And to aid with his recovery, he is to undergo range of motion, stretching and strengthening exercises, and occupational therapy. We will be providing his walker and a wedge pillow, and our hospital social worker has organized hiring a toilet racer for 2 weeks. So we've touched this one: physiotherapy, occupational therapy, and then from your discharge plan, we have continue exercise program and the equipment as well. Okay, about monitoring medications, that's reflected here in the third paragraph. He may have 2 Panadine Forte. Okay, so he may have 2 Panadine Forte. Okay, so going back, we have the 5th paragraph. I would also like to inform you that Mr. Baker has a follow-up visit at City Hospital Clinic on 21st September for his wound staples removal and blood tests. So mainly follow-up events, we may put them at the last part of your letter. Okay, and from your test booklet, we've covered this part here. Okay, so it's important to hand over to the nurse looking after him important details like this, not only in the hospital but also outside the hospital. So that includes staple removal and also blood tests to check his blood chemistry as well. And then we end our letter. For any queries, please don't hesitate to contact me. And then you have your complimentary closing remark, yours sincerely, and then your role. Okay, so the OET did not require writing your name, but as part of your writing test, your role, for instance, a charge nurse or registered nurse, is acceptable. Okay, overall, I believe that I've included the critical and important points that I have to include in the letter. Although my letter has exceeded the required number of words, like 180 to 200 according to the website. Although some sources say that the 180 to 200 word frame is just a guideline but not necessarily a requirement. Although I've seen in the OET website as well that writing less or writing too much may adversely impact your score. But I just feel that I had to include all this in this specific scenario or case. Okay, so that's it. I hope you like the content of this video, and I'll see you later. So again, if you like the content of this video, don't forget to click the thumbs up button, consider subscribing, and or sharing this video to your friends, relatives, or someone who you know that will benefit from this video tutorial. Also, don't forget to click the bell icon for future updates, especially from our healthcare series, IELTS series, and math series. Okay, so guys, I'll see you later. Keep safe and bye for now.